Okay, so in this class we'll discuss about two very important group of drug. One is antiplatelet and fibrinolytics. So before we go, so let's try to see what we can make out from the name itself. So ಹೆಸರಿಂದನೇ ಏನು ನಾವು deduce ಮಾಡಬಹುದು ನೋಡೋಣ. So antiplatelet ಅಂದ್ರೆ okay, it is antiplatelet acts against platelet. So ಎಲ್ಲಿ ನಾವು platelet against use ಮಾಡಬೇಕು. So what is the function of platelet again? So platelet mainly forms clot. Okay. So clot ಹೆಂಗ್ ಫಾರ್ಮ್ ಮಾಡೋದು platelet ಅಂದ್ರೆ ಫಸ್ಟ್ ಎಲ್ಲೇ ಬ್ಲೀಡಿಂಗ್ ಇತ್ತಂದ್ರೆ ಪ್ಲೇಟ್ಲೆಟ್ಸ್ ಅಲ್ಲಿ ಬರಬೇಕು ಪ್ಲಸ್ ದೇ ಶುಡ್ ಬಿ ಆಕ್ಟಿವೇಟೆಡ್ ಆಕ್ಟಿವೇಟ್ ಆದ್ರೆ ಮಲ್ಟಿಪಲ್ ಪ್ಲೇಟ್ಲೆಟ್ಸ್ ಎಲ್ಲ ಬಂದು ದೇ ವಿಲ್ ಫಾರ್ಮ್ ಪ್ಲೇಟ್ಲೆಟ್ ಪ್ಲಗ್ ಫಾರ್ಮ್ ಮಾಡುತ್ತೆ ಸೊ ದೇ ಸ್ಟಾಪ್ ಬ್ಲೀಡಿಂಗ್ ಸೊ ನಾವು ಆಂಟಿ ಪ್ಲೇಟ್ಲೆಟ್ ಯೂಸ್ ಮಾಡಕತ್ತೀವಿ ಅಂದ್ರೆ ವಿ ಆರ್ ಪ್ರಿವೆಂಟಿಂಗ್ ದಿಸ್ ಫಾರ್ಮೇಶನ್ ಓಕೆ ಸೊ ಎಲ್ಲಿ ವಿ ವಾಂಟ್ ಟು ಪ್ರಿವೆಂಟ್ ಯೂಸ್ ಯುವರ್ ಅಗೇನ್ ಟ್ರೈ ಟು ಇಮ್ಯಾಜಿನ್ ದ ಕಂಡೀಷನ್ಸ್ ವೇರ್ ಯು ಡೋಂಟ್ ವಾಂಟ್ ದ ಬ್ಲಡ್ ಟು ಕ್ಲಾಟ್. Absolutely don't want the blood to clot where it is not required in many pathological conditions, but specifically myocardial infarction, angina, so heart or vessels, circulation, ಏನಾಗುತ್ತೆ clot formation ಆದ್ರೆ so if there is formation of clot, so blood which is coming out of this vessel will be reduced, and if it completely blocks, there is no blood coming out. So there you cannot use. So this can happen in many system. Heart ಹೋಗಾದ್ರೆ myocardial infarction ಆಗ್ಬೋದು, brain ಹೋಗಾದ್ರೆ stroke ಆಗ್ಬೋದು, ಎಕ್ಸ್ಟ್ರಿಮಿಟೀಸ್ ಡೀಪ್ ವೇನ್ ಥ್ರೋಂಬೋಸಿಸ್, ಆರ್ಟಿರಿಯಲ್ ಅಕ್ಲೂಷನ್ ಆಗ್ಬೋದು, ರೆಸ್ಪಿರೇಟರಿ ಸಿಸ್ಟಮ್ ಆದ್ರೆ ಪಲ್ಮನರಿ ಎಂಬೋಲಿಸಮ್ ಆಗ್ಬೋದು. ಓಕೆ, ಸೊ ಕ್ಲಾಟ್ ಫಾರ್ಮೇಶನ್ ಪ್ರಿವೆಂಟ್ ಮಾಡಕತ್ತೀವಿ ಅಂದ್ರೆ ಸೊ ವಿ ಆರ್ ಯೂಸಿಂಗ್ ಆಂಟಿಪ್ಲೇಟ್ಲೆಟ್ ಡ್ರಗ್ಸ್. ಎಸ್, ಸೊ ವೆನ್ ವಿ ಡಿಸ್ಕಸ್ ವಿ ಆಲ್ವೇಸ್ ಡಿಸ್ಕಸ್ ದಟ್ ಇಫ್ ಎನಿಥಿಂಗ್ ಬಿಕಮ್ಸ್ ಎಕ್ಸೆಸ್ ಇಟ್ ಈಸ್ ವೆರಿ ವೆರಿ ಹೆಜಾರ್ಡಸ್. ಸೊ ನೀವು ಆಂಟಿಪ್ಲೇಟ್ಲೆಟ್ ಡ್ರಗ್ ಕೊಟ್ರೆ ಇಟ್ ಶುಡ್ ಬ್ಯಾಲೆನ್ಸ್, ಈ ಕ್ಲಾಟ್ ಅಷ್ಟೇ ಪ್ರಿವೆಂಟ್ ಮಾಡಬೇಕು. ಸೊ ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿ ಕೊಟ್ರೆ ಏನಾಗುತ್ತಾ, ಸೊ ಇಟ್ ವಿಲ್ ಕಾಸ್ ಬ್ಲೀಡಿಂಗ್. So you can guess the side effect of this, that is bleeding. Okay, so just by name we decided the role of platelet, which conditions we want to use this, that is uses myocardial infarction, angina, to prevent myocardial infarction. Adverse effect is bleeding. So each information gather ಮಾಡಿದ್ವಿ. Same fibrinolytics, so lysis ಅಂದ್ರೆ break ಮಾಡೋದು. So come back to this. So vessel ಒಳಗ as platelet ಮಾಡೋಕ್ಕಿಂತ permanent, if you are talking about permanent clot, it is fibrin clot. So fibrin clot aitandra two types, one is insoluble, one is soluble. Insoluble adre very very dangerous, soluble adre it can, it's again as a name itself suggests, it is soluble. Either now main aim is to lyse this. When we are talking about antifibrinolytics, we want to lyse it, so dissolve ಮಾಡಬೇಕು ನಾವು. So where again try to imagine the conditions, same conditions, but platelet ಒಳಗ it's in the progression ಆಗಕತ್ತೈತೆ ಅಥವಾ ಆಗಿರಬಹುದು. ಬಟ್ ಒನ್ಸ್ ಅತಿ ಫೈಬ್ರಿನ್ ಇನ್ಸಾಲ್ಯುಬಲ್ ಆದ್ರೆ ಯು ಕ್ಯಾನಾಟ್, there is no time, should not waste any time, you should lyse the fibrin. So ಯಾವ ಕಂಡೀಷನ್, ಸೇಮ್ ಕಂಡೀಷನ್ when they have gone towards very serious condition like myocardial infarction ಆಗಿರ್ಬೋದು, deep vein thrombosis, fibrin clot ಆಗೈತೆ ಅವಾಗಲೇ, stroke ಆಗಿರ್ಬೋದು, there you can again use this drug to lyse the fibrin. So adverse effect same. So excessive kotra, bleeding is the most common adverse effect. So just by the name itself we deduce these many facts about this group of drugs. Now let's go in detail about this. Yes, see in body there is always balance. So there are factors which will help in preventing the blood to clot itself. It stays in how it is in its in physiological state. So it maintains its fluidity, it will not become too viscous or it doesn't become too diluted. So full thick agala, full diluted agangilla. There are factors which will balance. So there are factors like platelet and fibrin which will increase the clotting increase ಮಾಡ್ತಾವ. But there is one more factor to negate this. So ಜಾಸ್ತಿ ಕ್ಲಾಟ್ ಆದ್ರೆ ಏನಾಗಿ ಮಾಡುತ್ತೆ ಬಾಡಿ, it will activate this system, plasmin system ಅಂತಂದು ಅದನ್ನ ಆಕ್ಟಿವೇಟ್ ಮಾಡುತ್ತೆ. ಅದೇನ್ ಮಾಡುತ್ತೆ, ಎಕ್ಸೆಸಿವ್ ಕ್ಲಾಟ್ ಫಾರ್ಮೇಶನ್ ಆದ್ರೆ ಡಿಸಾಲ್ವ್ ಮಾಡುತ್ತೆ. So there is always balance. So ಯಾವ್ದು ಜಾಸ್ತಿ ಆಗುತ್ತಾ it will cause more adverse effect. So ಜಾಸ್ತಿ ಕ್ಲಾಟಿಂಗ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಡಾಮಿನೇಟ್ ಮಾಡಿದ್ರೆ it will cause more of clotting. So there you can use this. So how this is what is going on physiologically in the body. So plasminogen ಇಂದ plasmin ಕನ್ವರ್ಟ್ ಆಗುತ್ತಾ, plasmin ಏನಾಗುತ್ತಾ, it will dissolve the insoluble fibrin to soluble fibrin fragments. Very simple. The drugs which we are discussing now, fibrinolytics, kinases ಅಂತ ನೆನ್ಪಿಟ್ಕೋರಿ, streptokinase, urokinase, alteplase, tenecteplase, they will activate this. So this is how they will lyse the fibrin clot. Okay, so exam olaga name fibrinolytics and kelakatara, streptokinase uses adverse effects kelakara. So this is mechanism of action. Yes, uses again as I told. Remember this, there are two types of myocardial infarction, ST elevation, non-ST elevation. These drugs are contraindicated in non-ST elevation or unstable angina. So I'll use madakagalla. Others, like I told, where you can see clots, deep vein thrombosis, vein olagadra deep vein, arteries olagadra peripheral arterial occlusion, CNS circulation agadra it can cause stroke, pulmonary system agadra it can cause pulmonary embolism. Okay, so there you're going to prevent this. What are the adverse effects? Like we discussed, bleeding and hypersensitivity reaction. Okay, these are some of the adverse effects. Next is antiplatelet drugs. What are antiplatelet drugs? Again, we discussed about this very familiar drug, aspirin, clopidogrel, prasugrel, ticagrelor. So ivella combination. Aspirin is standard plus these. Okay, so we'll see some more detail about this. Yes, we discussed bari platelet bundle plug form madakandre they should be activated. So activate hengaguttandra there are two receptors P2Y1 to P2Y1. So E receptors mele act madodrinda ADP act madi ATP all these things there is activation of platelet. So activate adage it can cause plug. So idu now activation prevent madidra it will not form a clot. So drugs like clopidogrel, prasugrel ivella ಏನು ಮಾಡ್ತಾವೆ they will bind to this receptor, they prevent the activation of platelets. Okay, so this is the mechanism of action of this group of drugs. First we'll go to aspirin, it acetylates or here specifically thromboxane A2. Irreversibly it will block thromboxane A2. Why thromboxane A2 is necessary? It changes the shape of platelet and helps in aggregation of platelets. Shape change ಮಾಡಿ ಅದನ್ನ aggregate ಆಗಿ clot form ಮಾಡಕ್ಕೆ help ಮಾಡುತ್ತೆ. So this is prevented by aspirin by blocking thromboxane A2. Okay, now one more important aspect is low dose aspirin 75 to 150 mg adrikinta jaasti koda higher dose aspirin where we use for anti-inflammatory analgesic action doesn't have antiplatelet action. For that we use lower dose. And the term irreversibly andre, so if a patient is on aspirin, if it's we know for a fact that it will block it irreversibly andre hosa platelet synthesis agotina that function is null, there is no function of platelets. So hosa bandre it will cause. So that's why if the patient is on aspirin we have to wait for new platelets to be synthesized, that is 5 to 7 days we have to stop the aspirin and only then surgeries can be performed. So that is clinical importance of aspirin. Dipyridamole, same mechanism of action, inhibits phosphodiesterase, blocks the uptake of adenosine. So we saw that, and remember this, it is always used in combination with aspirin. Clopidogrel, yes, it blocks platelet aggregation activation by blocking P2Y12 in a very simple way, and it also irreversibly blocks P2Y12. Okay, dose 300, but because it requires activation by CYP2C19, it will take a slower action. Onset of action is slow, 4 hours to take. It will take for action to start. So that is one more fact why, because of which we are adding aspirin. One important combination to be avoided is omeprazole plus clopidogrel because of the interaction with CYP. So this is very important aspect about this drug. Okay, so uses we have discussed myocardial infarction, stroke. So myocardial infarction start adaga you can give low dose aspirin. Next, to prevent myocardial infarction you can write use of the prophylaxis for myocardial infarction. Risk factors iddu ಅಥವಾ family, the patient is elderly with family history idra you can start aspirin prophylactically to prevent myocardial infarction. Stroke olaga to prevent stroke olaga we use aspirin plus clopidogrel and other combination. Adverse effect andra bleeding, neutropenia, thrombocytopenia and bone marrow depression. Very rare, but the bleeding is one which you should always be cautious about. So this is about antiplatelet and antifibrinolytic drugs.